The body's default mode is always to move towards wellness. It just inherently fixes things. If you cut yourself, you don't go, great, I'm going to have this open wound my whole life. It's like, well, no, I just kind of put the edges together and keep them there long enough and it fixes itself. You know, all this kind of, you break a bone, the body heals it.
Dr. David Bilstrom is a medical doctor and a quadruple board certified in functional and regenerative medicine, integrative medicine, physical medicine and rehabilitation, and medical acupuncture. He is the director of the International Autoimmune Institute. Dr. Bilstrom wrote a book on reversing and preventing all autoimmunity. He spends a lot of his time training practitioners on how to reverse and prevent autoimmune diseases.
We all have a lot of bad genes. We all have a lot of good genes. Well, if you're not feeling well, it's because you turned on too much of the bad and turned off too much of the good. And it's one reason why it's so easy to start getting a lot of things going haywire at the same time, or one thing after another, because over time, every cell is being told the wrong information. And so this is where things that work through epigenetics have such a profound impact on the system, because...
Hi, my name is Chris Burris. I'm a longevity expert and the chief scientist at a lab focused on a longevity molecule. My primary focus is to help people live longer and better lives with science. Make sure to subscribe and share so you and your friends can live longer and better, well, actually, so you and your friends can live beyond the norms.
Hi, and welcome to the next episode of the Live Beyond the Norms Health and Longevity Podcast. Nearly 60% of Americans have at least one chronic disease, and it's estimated that 1 in 10 suffers from an autoimmune disorder. But what if I told you the reality is far worse? What if these numbers drastically underestimate the issue? Research suggests that up to 80% of Americans show signs of inflammation, a major driver of autoimmune conditions. What if we're looking at autoimmune disorders all wrong, and like so many other systems in our bodies, they exist on a spectrum? Could it be that nearly all of us are grappling with autoimmune disease to some degree, often without even realizing it? Our next guest is the kind of guest I love to have on the podcast. Dr. David Bilstrom is a medical doctor and a quadruple board certified in functional and regenerative medicine, integrative medicine, physical medicine and rehabilitation, and medical acupuncture. He is the director of the International Autoimmune Institute. Dr. Bilstrom wrote a book on reversing and preventing all autoimmunity. He spends a lot of his time training practitioners on how to reverse and prevent autoimmune diseases. I love getting to the root source, those who actually train the front line, and look forward to this conversation. Dr. Bilstrom, thank you so much for joining us today.
Thank you so much, Chris. Great to be here.
So you went to TCU in Texas. Go Texas. I'm in Houston, so everything's better in Texas. I don't know how you might compare that to Idaho right now. You graduated cum laude, awesome. Then studied medicine in Illinois with your residency in Colorado. And looking further into your history, it looks like you've lived in Colorado, South Carolina, North Carolina, Illinois, now Idaho. My dad was in the Air Force, and I know how moving, well, we moved every 2 years. I know how traumatic that can be. Where did you grow up, and what was it like growing up as not yet Dr. David Bilstrom? And were there any early indications that you were going to pursue medicine?
Well, originally I grew up around Chicagoland area and actually started playing tennis at a very young age and traveled all over the place, all the, California for a couple. Here I am, 12 years old, back in the day when my parents would drop me off at O'Hare Airport, and I'd fly out to California for 2 weeks on my own and go to national hard courts, Pacific Coast Championships, had to find my way from south of San Francisco for one tournament, north of San Francisco for the other. And so I was real familiar with moving, but that's how I got to TCU, is I played tennis down there, Division I tennis player. So go Horned Frogs, to be even more specific about Texas. And so, I was very used to moving places to be able to accomplish what I wanted to accomplish. And it was a couple years into playing college tennis in college that I said, okay, I really love science. I love what I think medicine could become. And so then I kind of shifted my focus to pre-med. And then that's when I ended up getting back to University of Illinois for med school, and then University of Colorado for my residency.
So tennis at a high level, you're studying, what were you studying initially?
Actually, I was an English and art history major. originally.
So opposite ends of the spectrum, kind
Well,
of.
you would think, but actually, I see a lot of uh, you know stories, novels, but art and artists and the lives of artists really resonate with me in how they apply to medicine and how the human body works.
Well, yeah, and you go back to the great philosophers, like they were amazing scientists and typically amazing artists. I think there is this intertwining, and I've had conversations with people. I'm like, you often think of an engineer as somebody who's like super analytical and not creative. They actually have to creatively use the tools that are available to them, and that really applies to so many things.
It very much does, yes.
So playing a high level of tennis, you switched from the arts into medicine. Was there anything in particular? Like I imagine you were pretty analytical about how can I optimize my performance on the tennis court. Was there anything in particular that said, okay, now here we are. This is medicine. I can help people, or I enjoy it that much, or any instance come to mind?
I think I really enjoyed the complexity of science. But then when you dive deep, the complexity of art and the complexity of literature and all this. And so I love to do like deep dives into things that are really complicated and multifaceted and all that. And I just love to learn.
That makes perfect sense. So you finished your residency in 1990. By the way, if I have any of these facts incorrect, please correct me. You finished your residency in 1991 in Colorado, and then founded a medical acupuncture program in 1998 in Illinois. Again, you had a move in there. My sense is that traditional medicine does not really think much about acupuncture. What led you down the path, and did you ever get pushback from your medical colleagues?
Oh, you asked some great questions. So between the Colorado and Chicago, my first job out of residency was in North Carolina, in Charlotte, at a big rehab center, Carolina's Medical Center, Charlotte Institute of Rehabilitation. So my subspecialty in rehabilitation was spinal cord injury. So everybody that I saw was either paralyzed from the neck down or the waist down. And very complex population. Every organ system was impacted by the trauma, the being paralyzed. And so the rehab docs end up being their primary care providers because their needs are so unique that just a regular primary care doctor wouldn't have sort of the knowledge to help them, might suggest something for a stuffy nose that you or I might not even think twice about, but it might kill them, kind of a thing, just over-the-counter supplement medicine. But they're so complex and have so many health issues, we can easily run out of options. There's just not a lot of medicines to treat the things that are going on with them. And so I said, well, geez, wouldn't it be great if there's something out there that would help these people that I don't know about? And because they're so sensitive to the side effects of things that would always limit our options, wouldn't it be great if there was no side effects to this something? Well, as I kept diving deeper and trying to figure something out, that's when acupuncture popped up. And it's so good for pretty much anything in the body, no side effects. The worst thing that ever happens is nothing. But because all the time something good happens, it's been around 5,000 years. Nothing sticks around that long if it doesn't help most people, kind of a thing. And so I trained at UCLA in traditional Chinese medicine and medical acupuncture. And all my partners, there are 11 different partners that had different populations that were incredibly challenging, including rehab tends to be the place people get sent to when nobody else can help them. But if we couldn't help them as much as we wanted, we had no place to send them. And so when I got back looking to maybe start with a simple tennis elbow, instead my partners were saving the most complicated of all the complicated people. And oh my gosh, did it work so much better than I ever thought. Like immediately started working on these people. And I'm like, holy cow, I've been in medicine now for a while. I've been to, multiple big university settings, never heard anything about this. And it just works so much better than I ever thought. And then very rapidly, I transitioned to seeing about 100 people a week to do acupuncture. But it also got me thinking, well, geez, what else is out there that can help these folks that I never learned about? Because I never learned about acupuncture. And this has set me on a multiple decade course just to learn what is out there that I never learned about in traditional training.
So, you're saying that your treatment options were limited because of reactions, is that just because the organs are already overloaded in people who have this paralysis? Like why I'm just trying to wrap my head around why was the reaction so severe, or like what was limiting your kind of toolkit?
Well, in more able-bodied people, you take a medicine and it has side effects, and you might go, well, overall I'm using this medicine for this, but overall I'm, relatively healthy. My organ systems are in relatively good shape, and here's a dry mouth and constipation a little bit, no big deal. But in somebody whose organs are so compromised already, any little additional compromise is just puts them over the edge, kind of a thing.
Yep. That makes it's an overtaxed system already, and so things can be a lot worse. Yep. It sounds like your colleagues saved, like, oh, you're going to go do this acupuncture thing, and then you're going to come back and we're going to throw the, like, good luck with this. Talk about is that a fair description? And then talk about some of the initial results that you were having that you were kind of floored by.
Yeah. So some of my colleagues were more open-minded than others, including the medical director. So this is UCLA. There's continuing medical education credits because the science-based. And so when I requested using my continuing medical education budget, which we get so much money every year and so many days to keep learning, he goes, well, we'll let you go, but you can't use your CME money. And I'm like, well, what do you mean? It's just like, continuing education. No, we'll give you the time, but you can't use our money for this. And I'm like, okay, well, the gauntlet has been thrown down.
Right. That's
I'm going. There's probably a really great reason I'm going when you say I can't use my money. So I'm really going to be fascinated by this. But when we were on call, we'd be on call for a week at a time. And so we cover everybody's patients, after hours and on the weekends. Well, if you got a call on a weekend from a nurse and she said, well, we have one of Paula's patients. And we go, oh, not a Paula patient. One of our colleagues that had the worst of the worst, just for some reason everybody gravitated to Paula, and she was just the sweetest person, which might be part of that, but she's very open-minded. So one of the first patients I had was a Paula patient, and I'm like, oh my gosh, she's on like 40 meds. She's had like 50 different surgeries in her life. I'm like, oh my gosh, this is like, I wouldn't want to call on the weekend to see this person and answer a question, let alone now I'm kind of, in a position to try to help this person as best I can when I'm kind of feel like I'm a newbie. And oh my gosh, she got better. And I'm like, holy cow, it doesn't matter how complicated, how many decades of health issues you've had. Wow, look at the body healing. Because actually what acupuncture does is it just gets the body to fix itself. And the body's got this amazing, basically the body's default mode is always to move towards wellness. It just inherently fixes things. So like if you cut yourself, you don't go, great, I'm going to have this open wound my whole life. It's like, well, no, I just kind of put the edges together and keep them there long enough and it fixes itself. All this kind of, you break a bone, the body heals it. The body's really great at healing, but specific things happen that make it really hard for the body to heal. And then all you got to do is kind of like get whatever it is that's getting in the way out of the way. And the body goes, hot dog, I've been waiting for my opportunity. I'll take care of this now.
It knows what to do. As you're going through kind of the acupuncture coursework, was everybody in that class a medical doctor? Did you have some sort of advantage, do you think, because you were a medical doctor, kind of the way that acupuncture looks at things?
Yeah, so it's a specific training for medical doctors. So the training is in medical acupuncture. And so part of the advantage is that everybody started with a really solid foundation in how the body worked. With all our knowledge of med school and then residency and being out for a while. And then they were able to kind of like start from that point and then build on it with more of the new learning. And it was just fascinating the way the body worked. And there's so much scientific data about this stuff that I never, if you would have said, well, is there much science about this? I'm going like, I don't know, probably not. Because if there was, I would have learned about it. Oh my gosh, even back then, there was so much science. Acupuncture had been around already for 170 years already. So acupuncture actually developed right along with our traditional allopathic medicine. So traditional allopathic medicine is hospital-based medical care, hospital-based medical training. Well, that started in Paris in the 1820s. Well, they started doing acupuncture at the exact same time. So the growth of acupuncture and sort of Western medicine totally happened at the same time that this Western allopathic model got going, including acupuncture itself got going really early in the 1840s in Philadelphia. It was Benjamin Franklin's grandson who was a doc. And because Benjamin Franklin was our ambassador to France, he came in contact with acupuncture a lot when he was over there. He shared that with his grandson, if I understand the story correct. The grandson trained in Paris and then came back and started doing it in Philadelphia. So we've actually been doing acupuncture in the United States since like the 1840s.
Wow. Yeah, I would not have guessed that fairly recently. So you wrote a book, The Nurse Practitioner's Guide to Autoimmune Medicine, Reversing and Preventing All Autoimmunity. Why did you address specifically nurse practitioners? I imagine there was some logic behind that.
Hopefully logic behind everything we do, because I'm a scientist, I'm a doctor, so hopefully there's logic behind everything. So physicians tend to be fairly closed-minded, I've found. You know, if it's not what you already know, then there's nothing
it's
to
the
know.
unknown, yeah.
Really. And if you didn't learn about it in traditional training, well, it's probably not worth learning about. And kind of the same sort of mentality I had, where I would imagine there's probably not much science behind this. Oh my gosh, did I learn different? There's so much science behind this, but I think that's the general sort of, well, there's, that's a bunch of hooey. There's not really science. If there was, I would have learned it, kind of a thing. And so it can be really challenging to change people's minds like that. Now, nurse practitioners, on the other hand, who are becoming certified to be, not required to be overseen by a medical doctor. They can practice independently in most states in the U.S. now. About 2/3 to 3/4 of all the states now allow this. But nurse practitioners inherently in their training, they're trained a lot more holistically and a lot more patient focused than disease focused. And one of the trouble with trying to deal with chronic disease is if you focus on the disease but not the patient, you're really missing the whole, you're missing everything basically.
Yeah.
And so nurse practitioners, being more patient focused and more holistically, they tend to think more outside the traditional box. Like, well, how are you feeling? What are your thoughts about this? Where do you feel like we need to go? We're working as a team here, kind of a thing. It's not just me telling you what to do. You need to work together. I need to find out who you are and what's important to you and what makes your quality of life high quality, so that I can help you get there. And that's just not the way, unfortunately, we tend to think of, chronic disease management, and definitely not when it comes to prevention of disease before it even really gets going, kind of a thing.
Yeah.
And so I've hopefully I'm wrong, but my thought was that if we're going to really get somebody in every community that knows how to do this stuff, because until somebody's in every community, nobody's going to know, wow, we know where this stuff comes from, and wow, we can actually make it go away. And I think the nurse practitioners will probably lead the way in that.
Interesting. Like that makes perfect sense, and it's almost like a grassroots. Then instead of top down, you're like, let's go from a grassroots perspective.
Yeah.
On your website, there is a paragraph that says you declared and named a positive ANA as Bilstrom's Nuclearitis. What does that mean? Like, this sounds awesome. Like, I'm reading that, like, that sounds amazing. I'm trying to do a little bit of research to understand it, and I couldn't figure anything out.
Well, I'll give you a little history. So I'm not the first person to have their name on something. And so one of the autoimmune diseases that's very common is called Hashimoto's thyroiditis. And so it's an autoimmune disease that attacks the thyroid, and it was first described by Dr. Hashimoto. And so as I was seeing patient after patient and all this kind of stuff, and really learning sort of the topography of how this autoimmune stuff was perceived, is there's an autoimmune process called that you can test for in a blood test called ANA, anti-nuclear antibodies. So these are antibodies that the immune system is making that attacks our own nuclear material, our own DNA, our genes. And it's the genes, the DNA, that tells the cells what to do, basically. And so, kind of rule of thumb, you don't want to piss off your DNA, because then it's going to start telling the cells all the wrong information. But here's this anti-nuclear antibodies. It's right there in the name. It's one of the first ones that goes positive before The shit starts hitting the fan more and more as time goes on. But what people were doing is, well, there was no name for it. It was just a blood test, and it was either positive or negative. And if it's positive, well, how bad is it? Because it has different gradations of how bad it is. And but nobody would do anything. And what they would say though is, well, this positive ANA, you're moving to things like rheumatoid arthritis, lupus, Sjogren's, mixed connective tissue disease, all these autoimmune diseases that had names. We know you're moving to one or more of those, and you probably will get to the next one. The first one you'll get to is in 5 to 7 years. But we're not going to do anything. We're not going to do anything. We're just going to watch you. And you're going to start feeling worse and worse as time goes on. But eventually you're going to start attacking another body part, maybe another part of your DNA, maybe your joints, maybe your connective tissue. And then we're going to go, oh, okay, so we knew this was coming the last 5 to 7 years. And we know it's going to be terrible when you got it. And now we can give you a name, because now you're attacking a different body part that already had a name. But we're not going to do anything to prevent it. And once you get it, we're not going to do anything to make it go away. All we're going to do is offer you this kind of bandage medicine, a medicine that suppresses the immune system, a biologic and immunosuppressant that's going to put a bandage on a certain symptom. But we don't know what medicine to put you on until you get that certain symptom, right? Well, is it a joint thing? Is it a whatever thing? I'm like, well, how ridiculous is that? You know this bad stuff's coming. You're not going to do anything to prevent it. And you just wait till it gets worse and worse and worse. And then the only thing you give them is a bandage medicine in the first place. And then we know that once you get one autoimmune disease, you're much more likely to get a second and a third and a fourth and a fifth. Because truly, it's not like hundreds of different autoimmune diseases. It's just one disease that could attack any body part. And what really, one of the things that really got me going is that I was watching this podcast by these supposed experts on autoimmune disease. And one of the experts in one of those diseases that you always get to out of Johns Hopkins says, well, we consider a positive anti-nuclear antibody as a not fully formed autoimmune disease process. And I'm like, not fully formed? Well, that sounds promising, right? If it's not fully formed, it should be easier to deal with than a fully formed thing. But they don't do anything about it. Right? They just watch until it gets fully formed. And I'm like, well, this is like diabetes. I mean, truly, if you run the right blood test, and it's a simple, hey, check the blood sugar and the insulin, what can be simple? You can see diabetes coming 10, 20 years ahead of time. And you go, well, pre-diabetes, your blood sugar is like 30, 40 points above where it should be. Well, it's not fully formed diabetes yet, but we're not going to do anything at all until it's fully formed. Well, how silly is that? Why would you do that with autoimmune disease? So I said, well, we got to put a name on it. Okay, until there's a name. So I said, well, I'm going to name it Bilstrom's Nuclearitis. I named it in 2018, showed up in a textbook in 2020. And I said, okay, so now when this blood test, this autoimmune process, autoimmune marker is positive, we have a name. And we're not going to sit around until it gets worse. We're going to put a name on it and said, okay, now what are we going to do to make this go away? We're going to address why you got it. We're going to make it go away. As we do that, you're going to feel better and better. And we will have prevented you from going to these other terrible places. How much better is that?
So was that a hard thing to do, right? So it sounds like they've just like, hey, we know you're going down there. And by the way, I had an interview last week, actually at the A4M conference that I was at, having a conversation. And she's like, they did this early cancer test. They identified that there was some cancer present. It was too small. Oncologist is like, we're just going to wait till it gets bigger and then we'll take it out, right? It sounds like the same kind of scenario. And she's like, no, we're actually going to address this now. Sounds awesome. It seems like if you just give it a name kind of in the medical community, now you're like, I have this thing and so we need to take care of it. Was that a hard thing to make happen?
I just did it.
It's in a textbook and you're good.
And when you see the data out there where 250,000 women of childbearing years in the U.S. have a positive ANA already.
Wow.
And you're like, oh my gosh, all of them are just sitting there basically with this time bomb ticking and nobody's doing nothing. The data is there. They know they have it. They test, and it's just nobody's doing anything. So it's, you got to start someplace. So that's why I named it and said, okay, this is going to change how this is all run.
That's pretty awesome. I feel like we skipped a little bit, right? So in the storyline, you're working with paralysis, right? And you've kind of gone into acupuncture. How'd you start really getting focused on autoimmune diseases?
One of the things that was really interesting about acupuncture is that you address these central mechanisms that drive all disease in every patient. And this is where, like, well, somebody comes in with one particular complaint, like this is my main complaint, where you can't treat that person just like the previous 9 people with that chief complaint. Everybody is different. And so low back pain, maybe 10 people come back to see me for acupuncture saying, my main problem that I'm here to see you for is low back pain. And I go, great, well, I want to know you more. I'm going to ask you questions. Well, one person's got low back pain and asthma. Other person's got low back pain and constipation, low back pain and irritable bowel syndrome, low back pain and brain fog, low back pain and whatever. So you got to treat each one of them different. But if you can get at this central mechanism in each person, they're in a position to fix everything at the same time. So person comes in, low back pain. They go, well, I wake up 4 times a night to pee. And I poop, if I'm lucky, every 3 to 4 days. And my pain is absolutely constant. 24/7, it's always there. So let me do the first treatment, and they come back next time, and I say, okay, so any change with the first treatment? No, everything's the same. I go, okay, so I have down here my notes. Your low back pain, totally constant, average of 7 to 8 out of 10, about 4 to 5 times a day, it radiates down your leg, your right leg. And they go, yep, that's all exactly the same. I say, well, what about your sleeping? Oh my gosh. Well, that's weird. Usually I wake up 3 to 4 times a night. I think I slept through the night every night this week. Well, that's kind of weird. And I go, well, how about your constipation? Oh, well, that's weird. That's so, I think I pooped every day this week. Oh my gosh, that is so weird. And I'm like, oh, no, we got it. We nailed the central mechanism. It's just that your body decided to fix this sleep thing and this pooping thing before it decided to fix the low back thing. And when you kind of know how the body works, it's like, well, that makes sense because the gut's such a central mechanism for stuff. And if you're not sleeping, you're not going to fix nothing, right? If you're up 4 to 5 times a night, that's going to mess everything up. And your body goes, well, let's fix that first. And then we're going to get at this back thing. And then sure enough, you just keep doing what you're doing and the back gets better. So I love that about acupuncture. And functional medicine kept popping up as the same thing. So functional medicine tries to answer the question, why do we get what we get? And if you know why you get something, you're in a position to address the why and make it go away, right? And if you address the why, it's the real big central mechanism that oversees everything. And you have these people that are ultimately complicated. It's almost like every organ system is adversely affected by this health challenge. And to most medical people, it can be really confusing. Like, well, how can everything be kind of whacked at the same time? In functional medicine, it's kind of like, well, that's easy. The only way that everything can be whacked at the same time is these really big central mechanisms off that drive everything. We fix that, you can fix everything at the same time. And I love that concept because that is a totally different concept than I was trained in my traditional allopathic medicine. But the acupuncture really set me up for, well, if you can fix these central mechanisms, you can fix anything, including you can fix things that there are no meds for. So like having worked in big medical centers for so many years as an acupuncturist, I'm 6 for 6 bringing people out of comas with acupuncture.
Wow.
And they were in the ICU for months and months and nobody could wake them up. They got them off the dialysis machine. They got them off the ventilator. They wouldn't wake up. And five of those times, it took 15 minutes. They woke up, hey, where am I? Out the door the next day. One time I had to come back the second day, and you can wake people up from comas, and you go like, well, there's no medicine for that. And if there was, they would have used it, of course. But I love the fact that you can do things that you just cannot do with medications, and you can help these people with multiple organ systems involved all at the same time. So this is where inherently I started getting the more and more complex people, including the people with all these autoimmune diseases. Women in their 20s with 5 autoimmune diseases, children, 8-year-olds with 4 autoimmune diseases. And I saw hundreds and hundreds of people like that. Well, then I read this absolutely heartbreaking story in the New York Times about this really famous journalist who was losing her life and her career to lupus. one of the autoimmune diseases. And her story that she wrote about in the New York Times was exactly the story I'd heard hundreds of times already, is I have these terrible things going on. It seems like I get one thing after another after another. I'm going to doc after doc after doc. Nobody can tell me what it is. I finally get the diagnosis like 7 years in, 10 doctors in, of lupus. Well, then the only thing they offered was something to put a bandage on a few symptoms that didn't fix the reason why you got it. And she kept getting worse and worse, lost her career, and was pretty much done with her life. Her quality of life was so profoundly affected, as you can imagine. I go, this cannot keep going. Somebody's got to do something about this. Somebody's got to change the way autoimmune disease is dealt with worldwide, because this is how everybody's story is. And then that's this last 10 years that I've been on the mission to change the way that autoimmune disease is dealt with worldwide.
Yeah, that's so your acupuncture actually opened your mind to functional medicine, which maybe your colleagues would have accepted more readily up front, right? Because there was probably some pushback with the acupuncture and about how to treat holistically. I have this picture of, a really fast-paced medical environment. And when you're talking about sitting down with somebody and like, you have all these issues, I want to know you more. So has the time you spend with patients evolved or devolved so that you're actually spending a lot more time with them? What does that look like kind of throughout your career?
I think inherently with rehabilitation, we do see the complicated folks. And so in my clinic as a spinal cord injury doc, we had 30-minute appointments, which is pretty much unheard of in most other professions. So even though 30 minutes is a lot less than I spend with them now, I spend it every visit's at least an hour, like in rehab, like with spinal cord injury, we had to know your living situation. We had to know your work situation. We had to know, are you a parent? Are you and because we had people that had, no running water, no indoor plumbing. Well, and they have like 5 steps to get in. Well, if you're in a wheelchair and you got all this stuff going on, we need to know, your family situation, your home situation, everything about you, so we can figure out a way to get your quality of life in a really good place despite all the stuff going on. And so I think we're just kind of trained that way. So for me, it wasn't a big leap to do the same thing with chronic disease of all kinds, including autoimmune disease, except that we dive even deeper, such as I need to know what diseases your ancestors have had. I need to know what went on during the pregnancy. I need to know what happened during your birth. As a child, your menstrual history, your every history you can possibly imagine. I need to know that, because what I can do is I can see what you got coming either generations before you got it or decades before you got it in your own life. I can see this whole timeline, bink-a-dink-a-dink-a-dink-a-dink-a-dink, to figure out how you got here. But with that knowledge, we're in a position to reverse the whole timeline, kind of a thing. And that's part of what kind of acupuncture taught me too, is that there's a timeline for these disease processes. So like when somebody has multi-organ system issues, I got like 10 different things that's bugging the heck out of me. As you do the acupuncture, you get rid of the most recent ones first, and then the second most recent, the third, fourth, fifth, and then you work your way all the way down to stuff that may have started as a kid, because you're reversing the timeline. And I always thought that was just the coolest thing, that you could, it's kind of like, well, that makes sense. That's the first thing that got better, even though it may not be the thing that you're complaining most about, because this is the timeline. Well, the same thing happens in all healing. And so this is where you can see things coming, but also it's so powerful that when you know what tends to cause this stuff to happen, either in previous generations or any place between the here and now and back then, you can go, oh, okay, I see exactly how this started. And I'm now in a position, because we know this, to prevent this from happening in other people. Like if a parent has an autoimmune disease, the children are so much more likely to get every autoimmune disease. Well, now I see maybe what happened during that pregnancy, what happened early in that child's life. And as I go, well, I know exactly what's going on with them, even before I do any testing. I can see what they're going to get, fortunately, like 2 decades or 5 years before they get it. And we're in a beautiful place to actually prevent it from happening in that next generation or even future generations, given the way that things get passed down from generation to generation.
You just said, okay, if I know your parents had this autoimmune condition, then the children are, more prone to every autoimmune condition. So it doesn't necessarily have to be the same autoimmune condition. Did I hear that right? Yeah.
And this is a good example of how all these autoimmune diseases are really just one disease that can attack any body part. And so, like, if a parent has rheumatoid arthritis, the child has over a 5 times greater risk of getting type 1 diabetes. Kind of a thing, different autoimmune disease, but basically the same disease, just impacts a different body part. But then the same thing applies backwards, where a child may get an autoimmune disease before the parent has gotten theirs. So you see a child with an autoimmune disease, well, I want to see the parents. I want to make sure they don't get this stuff, because I know this stuff runs in families. They just haven't gotten it yet. Let's make sure they don't.
Hey, super quick break from the podcast. Hopefully you're loving it. This is a way you can support the podcast and take advantage of a great offer. We're offering 50% off of one of our MCT bottles. MCT is an amazing oil. Add the ESS 60 molecule to it. It's even more amazing. All you got to do is leave a review on iTunes, send us a notification that you've left that review. We'll get you a coupon code that'll get you 50% off of our MCT oil and free shipping. Back to the podcast.
In my intro, I described autoimmune disease as potentially on a spectrum, and potentially all of us are suffering. How do you feel about that kind of perspective?
Well, knowing what we know about the immune system nowadays, I'd almost say that it's 100% of people are on a spectrum, especially if you consider that, there's things that happen that get passed down from generation to generation. So, what gets you on the spectrum started getting going. If you talk about epigenetics, you're talking 6 to 8 generations before us. If you're talking about passing down disrupted intestinal microbiome from mother to child to child to child and all this kind of stuff, you're talking big ways to fix the system before these things happen. But also you're talking, hey, you get put on the spectrum before you're even born, including when you look at like epigenetics. Well, here is, let's say, me, when my mom was pregnant with me, okay? But the egg from my mom that became me, she had before she was even born. So in women, all the eggs they're ever going to have that might become a child, they have before they're born. Well, I had 9 months of my mom being in my grandma, and her eggs being influenced by that before my mom was born, before I was born. So I had 9 months of influence from my grandma directly on my epigenetics. Well, my grandma had breast cancer twice. And I go, well, that's not a good place, because we know that prostate cancer is basically the same cancer as breast cancer. But if you're more likely to get breast cancer, more likely to get all cancers. We also know that cancer is the flip side of the same coin as autoimmune disease. So if somebody has cancer, they're more likely to get autoimmune, and vice versa. And I'm like, well, heck, that wasn't a great 9 months of epigenetic connection with my grandma, because she ended up with a lot of health issues, kind of a thing. And so you can see how, this, driving autoimmune could have started before your mother was even born, because of the 9 months that you were involved in your grandmother's epigenetics that may not have been optimal, kind of a thing. So you can get this stuff going a couple generations before you even get going.
So you're doing a history, right? Like very standard medical history, and looking for, somebody may be coming in for rheumatoid arthritis, and you're looking for anything like the other indicators. Do you do any genetic testing? Are there good genetic tests to kind of identify some of the things that you're kind of managing regularly?
I don't, because one of the things that epigenetics tells us is that it's not so much what genes you have, it's which ones get turned on and turned off. And so epigenetics is the things that alter gene expression without changing the genetic code. And so it turns out we all have a lot of bad genes. We all have a lot of good genes. Well, if you're not feeling well, it's because you turn on too much of the bad and turned off too much of the good. And it's one reason why it's so easy to start getting a lot of things going haywire at the same time, or one thing after another, because over time, every cell is being told the wrong information. And so this is where things that work through epigenetics have such a profound impact on the system, because they're flipping genes the right way in every cell to body at the same time. So they're like these central mechanisms that allow you to fix everything. So we go, well, everybody's got bad genes. We have to turn those suckers off, kind of a thing, including there's so many bad genes on the X chromosome. Women have 2 copies of the X, guys have one X, one Y. One reason why women get 80% of all autoimmune disease is because there's so many bad genes on the X chromosome that for women to be optimally healthy, she has to be able to shut down at least 85% of the entire second X chromosome to avoid excessive X chromosome impact on health or ill health. And so we use a supplement called butyrate a lot clinically. And butyrate is something that, maybe people haven't heard about, but it's made by the good bacteria in the gut. The good bacteria in the gut make a lot of important things. Serotonin, the feel-good neurotransmitter. GABA, the calming neurotransmitter, makes melatonin, which could be about 5 podcasts all by itself, an impact and how that is. But they make these short-chain fatty acids. One of them is butyrate. Well, butyrate almost exclusively works through epigenetics. So it's flipping genes the right way in every cell of the body at the same time. So it's preventing and killing cancer cells 5 different ways. It's profoundly impactful for brain and lung and you name it, because it's flipping genes the right way in every cell in the body. We should be able to make that, but there's ever so many things that disrupt our good bacteria in the gut. Our intestinal microbiome gets disrupted, and we don't make enough, and then we're compromising the body's ability to make something that helps everything stay healthier, kind of a thing. And so the body's trying to do this on its own, but things happen that compromise the body's ability to do this, but we can, kind of get it back to where it should be. So you fix something called the vitamin D receptor resistance in the gut. Vitamin D receptors become resistant to vitamin D, disrupts the intestinal microbiome, creates a leaky gut, there's all this stuff. And you fix that, and now you start building your good, getting rid of the bad bugs in the gut. The good bugs that build can be the butyrate producing good bacteria. Now you start making it on your own. Now you're flipping genes your own self, but then that's a great way. And then you lock the system in place, and then you can do that on your own long term. Having done now our due diligence to prevent future disease.
Is that involve like dietary changes? Obviously, butyrate is made by some of our gut bacteria. Any value in probiotics there, in your opinion? And then, what are the things that you're doing to kind of shift the tide there?
The only food that contains butyrate is butter. And this is one reason why I think pretty much every culture in the world uses some kind of butter. Most people use cow's milk butter. A lot of people around the world use goat's butter. People in Himalayas, Nepal, northern India, Tibet, they use yak butter. Everybody's using some kind of butter. And, that's the only butyrate containing food. So I think that makes a lot of sense. But really, we should be able to make it on our own. But there's ever so many things that mess that up. But you should be able to correct it. Now, there's a lot of good bacteria to do a lot of things. The things that we might be able to do to increase the butyrate producing good bacteria is some of the most important.
So we're kind of switch back to everybody's on some scale. Potentially 100% of us are on autoimmune disease scale. What is the person who isn't on that scale? What do they look like? And some of it is like their parents didn't have it, which might be hard. What are they eating? What are their lifestyles? Like, what if you were like paint a picture of the ideal person who doesn't have any autoimmune disease?
I'm not sure they're out there. In fact, in functional medicine, we always kind of talk about, you can't see the person dying on the inside by looking at the outside. And so this is where you get 25-year-old guys that look super healthy. They're dying of heart attacks nowadays, just dropping dead. And you're like, oh my goodness. That used to be in the 40s, then it used to be in the 50s, then it used to be in the 70s, but now it's worked its way down to the 20s. It's just so challenged to be healthy nowadays that truly you cannot just look at somebody and go, oh, you're healthy or not. You could be dying and you look at it on the outside. Oh, I exercise 3 hours a day. Oh, I eat really healthy. And you're going like, well, that doesn't guarantee you anything, right? And that's part of the problem with preventative medicine these days is, how can I prevent stuff? Whether it's in my family or it's just people I know or the people I see, I don't want that stuff. Well, change how you eat and exercise. Well, that's incredibly complicated, but incredibly vague at the same time. It's like, well, how do I eat and how do I exercise? Well, we know so much about how the body works. We're so much smarter than that. It's just really terrible. Is we know exactly what causes all this autoimmune, all this chronic disease in general, and there's things that you can do that have this profound impact on the system, so much more than just that stuff, such as Harvard figured out 17 years ago that meditation works through epigenetics. And then they go, well, oh my gosh, that's why meditation, repetitive prayer, deep breathing, progressive muscle relaxation, getting out in nature, all this stuff has this profound impact on the system. It flips genes the right way. Vitamin D levels, profoundly important, totally underestimated in the minds of just about anybody. If women's vitamin D is above 60, now we want people's vitamin D between 70 and 90. If a woman gets her vitamin D above 60, she's decreased her risk of ever getting breast cancer by 82%. If a mom's vitamin D is above 50 during pregnancy, she's decreased in half the child risk of ever getting multiple sclerosis. Autism, 70% of all autism is one particular autoimmune disease. I just did a video about this autism. Well, vitamin D supplementation during pregnancy and early childhood reduced the recurrence rate of autism in newborn siblings. Medical hypotheses 2016. So what they took is women who already had a child with autism, and if you don't do anything, a 1 in 5 chance the next child's going to have autism, a 20% chance. Well, what they did is they took half of the women in the study, didn't do anything. Other half, they had the mothers, the pregnant women, take 5,000 IU of vitamin D every day during the pregnancy. Very low dose, nowhere near ultimately therapeutic, but it's a dose. And then for the first 3 years of life, they gave the child 1,000 IU per day. Pixie dust dose. No way is that therapeutic, but a little something goes a long way when you're talking about early in life. And rather than 1 in 5 children getting autism, is 1 in 20.
Wow.
5% chance versus 20% chance. Not even being therapeutic in the doses. Nobody did blood work to go, hey, that dose right there, that ain't doing shit much. But boy, a little bit goes a long way with the right stuff, like this powerful stuff. And if you actually got everybody therapeutic, there's no telling how much prevention we could do with that kind of stuff. And so, those are the kind of things that you're talking like, oh my gosh, that's huge. And boy, it was so easy. The body is so smart. If you know kind of what the body is needing, a little bit goes a long way.
I know it's oil soluble, but maybe we can replace our fluoride with vitamin D. I know that's on the radar. What should people be looking for early on, right? Like I guess it's unfair. Anybody listening, like, hey, you're listening to this, you're on the spectrum of autoimmune disease, right? But what should they be looking for to really say, okay, now I need to start addressing this? What should they be looking for?
Well, I think because, cancer is the flip side of autoimmune disease, is if in your family history anybody's had cancer or autoimmune disease, you're like, I'm going the wrong direction already. During the 9 months of development during pregnancy, if there's much in the way of pregnancy-related complications, the way the whole system has been set up has gotten compromised, including the immune system. If a child's born premature, preterm birth, the liver's not fully formed in us until about 8 months after we're born. So during that 8 months, the liver's in a precarious position. It's easily dinged, and the liver is a super central mechanism in how the system works. And so preterm babies, their livers don't make as much of something called TUDCA, TUDCA. It's a secondary bile acid. They also call it the chaperone molecule. It is incredible central mechanism. So preterm babies' livers don't make as much TUDCA as term babies. Thus, those preterm babies are so much more likely to get type 1 diabetes, where they stop making insulin and they have to be on insulin pumps and insulin shots. And there is a super epidemic of type 1 diabetes, but it compromises the system so profoundly that they're much more likely to get type 2 diabetes as an adult. So like decades later, that hit is starting to show itself. Now, if a baby's born and has jaundice around the time they're born, the liver got dinged temporarily, bilirubin is building up in the system, makes you look yellow. Well, that child has a 25% increased risk of type 1 diabetes because that liver can't make this TUDCA. And so you can see things happening like at those ages that you go, oh, that's not so good, including 80% of the immune system surrounds the gut. So if you're a child, or you have a child, or you look back to your history where you kept getting like ear infections or strep throats or sinus infections, and you need a fair amount of antibiotics. Well, you got stuck in this vicious cycle of, I got an infection, I used an antibiotic to get rid of it, but it disrupted the intestinal microbiome. But then that threw off the immune system, so you got the same infection again. So you use an antibiotic, threw the gut off, but threw the immune system off, you get the same infection again. Now, the body is so smart, it's going to usually work its way out of that vicious cycle, so you don't keep getting ear infections, strep throat, sinus infections, UTIs your whole life. But by the time you work your way out of that vicious cycle, you have a totally disrupted gut and a totally disrupted intestinal microbiome. You know you're not going to places you want to go. But then when you look at the immune system in general, and the immune system is a really fantastic example of how the body likes balance, where you don't want to be too high or too low in anything. So like blood pressure, where you don't want to be too high, well, you don't want to be too low either, kind of a thing, right? But with the immune system, when you lose that set point right in the middle, you actually move away from it up and down at the same time. So the overactive immune system issues are things like all the autoimmune diseases, but also allergies, asthma, and eczema, a skin issue. Underactive immune system issues, colds, flus, infections. I get the same infection over and over and over again. Pneumonias, bronchitis. But then here are these infections that drive chronic disease that not many people are talking about, unfortunately. But here's cancer. And so this is why they talk about cancer being the flip side of the same coin as autoimmune disease. Well, if you're a young person or an adult with allergies, asthma, eczema, I keep getting infections a bunch. You're like, you've lost your set point. You've moved away from that set point. You're going to keep marching along, and before you know it, you're going to get an autoimmune disease or cancer. But we can see that immune system disruption a lot of times at very young ages, and we go, oh, well, something threw you off. Fortunately, we know exactly what does this, so we're in a position to do this, bring you back to the middle. And then you get rid of those immune system dysregulation signs. And we've done our due diligence to not only prevent cancer, but prevent you from ever getting autoimmune disease as well.
Okay, so my children, I have twins. They were born early. I know they were put under the whatever light for jaundice. You're saying that so I think it's just my son would have a 25% higher chance of diabetes, like type 2 diabetes at some point. Is that
type 1 diabetes, the insulin dependent kind? Yeah.
Type 1.
But whatever drives one autoimmune disease drives all autoimmune disease and cancer, because that's the immune system dysregulation that occurs. And this stuff is so common. It is so common. I mention this, and just about every time I mention this, somebody goes, oh my gosh, well, that applies to me and my family. I'm like, I know this stuff is crazy common. Common kind of a thing, right?
Yeah. Yeah, we're all on that spectrum. You talked about this, and I probably fell into this 20s through my kind of late 30s, where lots of antibiotics, lots of head colds, lots of whatever, and I'm out of that now. I just don't like I wait the 10 standard days for an antibiotic, and then it's usually gone. like that's just the normal. So to let a virus run its course and not hop on a antibiotic. But if we have been in that cycle, what do we do to fix the disrupted gut?
Yeah, so this is where we're really trying to educate people where this stuff comes from and kind of the signs of we need to kind of do some intervention, but also teach people how to fix it, because it's really not as complicated as it seems to do preventative medicine, like I suggested earlier. When you know exactly what throws off the system like this, you go, oh, okay, we won't waste our time doing a lot of things because that's not the biggest fish to fry. Here's the biggest fish to fry. So like, for example, on my website, we have a free online educational email course, just 7 emails. Each one's only about a 6 to 8 minute read, but we take a real deep dive into these different central mechanisms. The very first one's about epigenetics. Then we talk about the stress hormone cortisol that gets thrown off. Then we talk about the intestinal microbiome. Then we talk about the infections that drive chronic disease. Then we talk about how the gut disruption drives food sensitivities and how you can figure those out. there's a real big central mechanism, and it's the other reason why 80% of people that get autoimmune disease are women, is this thing called estrogen dominance, where women end up with too much estrogen compared to progesterone. And that is a humongous driver of this disrupted immune system, both autoimmune disease and cancer. And in this situation, that is so common also, it shows up initially as all these hormonal menstrual things. Bad flows, bad cramps, premenstrual syndrome, ovarian cyst, polycystic ovarian syndrome, fibroids, endometriosis, infertility, fibrocystic breast disease, estrogen dominance. Any of those things, you got estrogen dominance. But also because estrogen revs and progesterone calms, it drives rev without calm stuff. Excessive worrying, anxiety, don't sleep well, even panic attacks, or you go like, oh my gosh, in this day and age, it is so hard to stay healthy. What woman doesn't have either their hormonal menstrual or rev without calm stuff? It's just so common to have this stuff happen. But this is such a huge disruptor of the immune system. One of the reasons why 80% of people that get autoimmune disease are women, but women with estrogen dominance before menopause don't just have twice the risk of breast cancer as anybody else, or 3 times, but have a 5.4 times greater risk of breast cancer before menopause. Over 5 times greater risk of breast cancer, but at 10 times greater risk of malignant cancers their entire life, the kinds that start one place and metastasize, 10 times greater risk. And so these are the things we go like, well, all this hormonal menstrual stuff, well, it stinks. This rev without calm stuff, it stinks. But people don't recognize what it's telling us about what's going on. And we tend to use more bandage interventions than, well, let's fix the darn thing. And it's not hard to fix. Let's fix it. And then all the hormonal menstrual stuff goes away. You sleep like a baby. You're super chill. Well, that's a lot better there too. But now we've done our due diligence to prevent this other stuff that was coming down the pipe that you could see coming like decades ahead of time, and you're able to stop it before it ever got there.
Wow. We're coming up on time. This has already been fascinating. You talk about Glenn Frey, and I want you to share that story, right? Because people will know a piece of that, and then I've got my wrap up questions.
All right, yeah. So Glenn Frey, being an art lover of all kinds, music, art, literature, I see parallels in how this all works with medicine and how the body works. So Glenn Frey of the Eagles, the great rock band, right? He got diagnosed with rheumatoid arthritis, and he got put on medicines that suppress the immune system. Put bandages on things, but he just kept getting worse and worse and worse for about 20 years, and he finally died. Relatively suddenly, but you can see it coming like 2 decades ahead because you can see this stuff coming. And this is a common story. He didn't die of rheumatoid arthritis. What he died from was, they say acute, which means new, but it was really 20 years in the making. He developed a second autoimmune disease, which was ulcerative colitis, where now his immune system wasn't just attacking his joints, but was attacking his gut, his intestines. And basically you're like pooping blood like 20 times a day. I mean, it's just terrible, right? And when that hit, he also got this terrible pneumonia, an infection that no amount of antibiotics could get rid of because his immune system was so suppressed by the medicine. When you're on those meds that suppress the immune system, you're more likely to get cancer and life-threatening infections, and they can actually give you a new autoimmune disease on top of the old one. But if you didn't get rid of the reason why you got the first, you're going to get a second. So he didn't die of rheumatoid arthritis. He died of a new autoimmune disease, ulcerative colitis, and a pneumonia that no amount of antibiotics could prevent from killing him because his immune system was so suppressed. And his 2 really good friends, Jackson Brown and Bob Seger, talked a lot after he passed away that, they could kind of see this coming, miles away because he kept getting worse and worse, and they knew it wasn't working, and he was just getting sicker. And, they kind of say things like, well, I think it was the medicine that killed him. It wasn't the rheumatoid that killed him. I mean, that's for sure. But it was really just relying on a bandage medicine as the only intervention rather than doing better for the person. And then the medicine itself basically just kind of killed him, as well as not doing what you need to do in the first place. So it was such a sad story that could have been prevented. But also, his wife has an autoimmune disease. She has lupus. And then you look at his son, who plays the drums for the new version of the Eagles, and you go, oh my gosh, I fear for his health long term because he had it kind of coming from both ways here. Mom and dad had autoimmune kind of a thing. So it's a really great example of how this stuff is so common. It runs in families, it gets passed down from generation to generation, and we people deserve better than that kind of care.
Yeah, sometimes the famous person can help highlight things for us to really cause us to pay attention. This has been fascinating, more fascinating than I even thought, and I was pretty expecting a pretty high. I had high expectations. Let's get into our kind of longevity and health podcast wrap up questions. Dr. Bilstrom, do you have a target age that you want to live to?
So I just reread a book by Jimmy Buffett called A Salty Piece of Land. It just like Jimmy Buffett's songs are all like philosophical as all get out, and this book is like all philosophical. Oh my gosh, it's just incredible. And one of the main characters' name was Cleopatra Highborn, and she was the captain of like a 180-foot schooner, sails and everything around the world, and she died on her 102nd birthday for a really particular reason, but she saw it and wanted to learn and sought things out her entire life. And I'm like, yeah, that's how it's supposed to be. Healthy, high quality of life, go around the world a million times, and then one day you're done. And I'm like, that's about right. That's about right.
So can we jot down 102?
I think, but if we might know more by that time, so maybe it'll be more than 102.
And how long do you think humans can live?
Well, the literature on longevity, I used to tell people, well, I still do kind of, is that nothing is age related until you're at least 90. Okay, if it's something before 90, it's something we should be able to figure it out. It's not age. Okay, but really it's looking like 107. 110, 112 is kind of what the body sort of is designed to do if given all the tools.
So 112, I like that. What are 2 to 3 protocols, habits, mindsets, let's call them shortcuts because everyone loves shortcuts, to longevity and a long health span that you can share?
Well, I got to tell you, we've been teaching people for decades about how nature helps human health and well-being. So there's all this data. We compiled a compendium of about 60 different scientific articles about this like 10 years ago. We have handouts for patients, the compendiums for medical people or administrators. We really want to teach people how nature helps human health and well-being. And some of the most fascinating data is coming out the last few years is about how light impacts us, both positively and negatively. So I lectured in Paris back in early June about the 4 maternal microbiomes during pregnancy that drive the development of the fetal microbiomes. The fetal gut microbiome is already developing before the baby's delivered. You have to set up a healthy placental microbiome. So optimal crosstalk back and forth between the pregnant woman and the developing fetus. And I said, well, this is how it sets up. This is what can disrupt it. This is how we can correct it. And so one of the things I talked about is how sunlight impacts us. And so back of our eyes, we have the retina. Now, most retinal cells are what they call image-forming retinal cells. Light hits the image-forming retinal cells. They project up to the visual cortex part of our brain so we can see images, like we're seeing each other currently. There's other retinal cells back there that weren't known to exist until about 2 decades ago, because they started going, man, something's going on with what these eyes are able to do for the health of the system that cannot be explained by the rods and cones alone, the image-forming retinal cells. Turns out there's these non-image-forming retinal cells. Light hits the non-image-forming retinal cells. They project to all these different brain parts. Parts involved in moods, parts involved in metabolism, eating practices. Do we gain weight? Do we not gain weight? Emotions. The master clock, called the suprachiasmatic nucleus, that oversees the 24-hour circadian rhythm of every cell in the body. Every cell has it. Every cell has to have it just right, or we're getting dinged. It also projects to the hypothalamus, which is part of the HPA axis, that hypothalamus, pituitary adrenal gland, cortisol, the stress hormone. That HPA axis is how the body deals with stress. And that's tied into cardiovascular health, immune health, you name it, hormone balance. Projects to all these different brain parts. It is, and because the intestinal microbiome is a 24-hour clock, that master clock oversees the peripheral clocks, such as our intestinal microbiome. Profoundly important, including, I got a chance to share in this lecture, that early in the second trimester, about a third of the way through the pregnancy, the developing fetus, the baby, has a lot of baby parts still to put together. 6 more months of baby parts, and then the liver still has another 8 months to go, and then the brain another 25 years to go. But the baby's eyes have already developed these non-image forming retinal cells. They don't have the rods and cones yet, but they have the non-image forming retinal cells. Baby's eyes start seeing light coming through the abdominal and the uterine wall a third of the way through the pregnancy. And what the science tells us is that it's vitally important for their eyes to see light so they can develop all these different things going on in the brain, HPA axis. So they're developing ways to deal with stress before they're even born. Their circadian rhythm is being reset. So they have a circadian rhythm independent of the mom. They're asleep when the mom's awake, probably awake when the mom wants to sleep, all this kind of stuff. The fetal microbiome is being set and all this kind of stuff. So it's a super central mechanism in how we set up the system during pregnancy, but it's a super central mechanism what we can use to reverse or prevent all these different diseases. And then the corollary is the toxicity of blue light and artificial light at night. So actually, I have this article right here, Light Pollution and Cancer. There's another article I have here about exposure to light at night stops tamoxifen from working. So when women get breast cancer, there's a lot of things you can do and a lot of things you should do to prevent it from ever coming back. And it's not that difficult, but nobody really does it. Usually what has happened is women are offered tamoxifen for 5 years. The only medicine they're offered, intervention offered by most traditional cancer docs to help prevent cancer from coming back. Artificial light at night, the lights in our homes, phones, tablets, all this stuff at night, totally stops it from working. So women are on this, and it's not doing a lick of good when they got artificial light at night, this blue light at night. It's hitting those non-image forming retinal cells and totally whacking the system. And so by increasing therapeutic light and getting rid of toxic blue light and artificial light at night, huge impact on the system, including, if I could maybe quickly read just like 2 sentences of this Light Pollution and Cancer from International Journal of Molecular Sciences, 2020. For many individuals in industrialized nations, the widespread adoption of electrical lighting has dramatically affected the circadian rhythm, organization of physiology behavior. Although initially assumed to be innocuous, exposure to artificial light at night is associated with several disorders, including increased incidence of cancer, mood disorders, metabolic disorders, so all the obesity and the diabetes. And you're like, wow. And we're just talking about the light that might pop in through our window at night while we're trying to sleep from surrounding areas is enough to like whack the system. And so I think you don't hear many people talking about this, but we've been talking about it in clinic and teaching people this stuff for about a couple of years now, is how we can use therapeutic light and avoid toxic light to help all this stuff, including when a woman's pregnant, loud and proud, bring that shirt up and let your baby's eyes start seeing this light as much as you can. The first 3 hours after dawn, when it's really heavy and the near infrared is the best, has this profound impact on the system, including babies love it, so they can put all their baby parts together.
Okay, so that would be, in terms of tips for longevity and long health span, one, pregnant women getting their bellies exposed to light, I think, is that a good summary?
And letting their eyes see the light as well, so that they can develop all this circadian rhythm. Their HPA axis is healthy, so the baby can develop their own HPA axis during pregnancy. So the eyes and the belly, and including these great studies that show the sunlight, the first 3 hours, the infrared spectrum actually optimizes the intestinal microbiome when it hits the abdomen, builds the good, gets rid of the bad. The good bacteria, they're predominantly built by light hitting our abdomen, are the butyrate-producing good bacteria. It works through their epigenetics, so 3 different genes in those butyrate-producing good bacteria become upregulated so they can make more butyrate per cell. So not only does the sunlight help make more of the butyrate producers, they can make more butyrate per cell with the help of the right sunlight.
Okay, so early exposure to sunlight for everyone.
Get the eyeballs outside. All it takes is 2 minutes 2 minutes or more of getting your eyeballs, and if you're living the right climate, your belly within the first 3 hours after sunrise, for example.
Excellent. Any others that pop to mind?
And like,
And real quick, I want to keep this more like a rapid fire.
oh, sure. And,
Yeah.
and so trying to wear high quality blue light blocking glasses as best you can when you're on screens and tablets,
Yep.
if you're on your phone for a while, but also consistently for 2 hours before bedtime, because just the lights in our homes have such high blue light spectrum nowadays that is super toxic. And if you wake up in the middle of the night, pop them back on, because you turn on a light, you look at your phone for an instant, you go past the night light that's got blue light. You do this with your phone. Hey, I'm gonna check the time. Boom, boom. Totally whacked the entire system. Yeah, so this is a really great way to maintain the health of everything, including, it's been shown this is what drives longevity, healthy lifespan, health span, not just lifespan with lots of diseases.
Excellent. What are 1 to 2 things people get absolutely wrong regarding longevity and a long health span?
Well, one thing that I tend to see a lot is when you get chronic health issues, we now know that infections are part of every chronic disease, not just autoimmune disease, but they're the infections that tend to drive chronic disease, chronic inflammation, chronic disease. And even if people have seen a lot of functional medicine people, I tend to see this get missed. So things like, people maybe know that Epstein-Barr virus, the monobug, can reactivate later in life and then drive like multiple sclerosis. But there's a host of other ones that can do this that are easily tested on a blood test. Any lab can run them. And then also the tick-borne diseases, not just Lyme's, but other ones. Boy, these guys drive chronic inflammation and chronic disease. And you can test them on easy blood tests. Now, we use a product out of Canada. It's a nano silver called pH structured silver solution that is an absolute game changer when it comes to getting rid of these chronic infections that drive chronic disease, including people kind of freak out sometimes. Herpes virus 6 is one of the ones we test for. It's not cold sore herpes. It's not sexually transmitted herpes. It's a different kind of herpes. Gets in, drives chronic disease. Chlamydia we test for on a blood test. It's not sexually transmitted chlamydia. It's a bacteria that drives chronic disease. I got a frantic call from a mom not too long ago. The health department contacted her because the lab identified chlamydia in her young child with juvenile rheumatoid arthritis. And I go, no, it's not that kind of chlamydia. It is a different kind of chlamydia. It's the kind that drives chronic disease. But it can really confuse people because people just don't know that these infections do this, and it's not tested for, and people do not get as good as they will if you get rid of the infection. And you get rid of the infection, you bring the immune system back to the middle. Well, now you don't get those infections ever again, and now you've locked somebody in place so they don't get the cancer, the autoimmune disease, or chronic disease in general.
Okay, so what they get wrong is not investigating the potential bacteria, the infections that they may have.
Viruses, bacterias, yeast,
Molds.
and then mycoplasma is another really common one, which is different than all the others, but once again, easily tested on blood test.
Excellent. And Dr. Bilstrom, how can people contact you?
So my website is drdavidbilstrom.com. And we have multiple courses for medical people, multiple courses for non-medical people. My book is available for both medical and non-medical people. And I do a lot of blog posts, including about early morning sunlight, artificial light at night. And so we're really trying to educate people so that they can make really great decisions all by themselves. They don't even have to sometimes see a doctor to help because they can do it themselves.
Awesome. And what in the near future are you excited about?
I'm really excited about how we can teach people about this light therapy because it is so impactful and so easy and so cheap. If you know where to look, you can get a pair of high quality blue light blockers for $30, and it doesn't cost anything to get your eyeballs outside. And so we're talking profound, easy, cheap, really nice way to go.
Excellent. All right. You can find him at drdavidbilstrom.com. Dr. Bilstrom, thank you so much for joining us today.
Oh, thank you, Chris. It's been my pleasure. Thank you so much.
I hope you enjoyed this episode of the Live Beyond the Norms podcast. Make sure to subscribe and follow. Also, make sure not to be that guy, the guy sharing this podcast with people who are not interested in living beyond the norms. If you would like to learn more about the ESS60 molecule, the molecule responsible for the single longest longevity experimental result on mammals in history, a full 90% extension of life, visit myvitalc.com. That's myvitalc as in carbon.com.